With the correction by the National Center for Disease Control, the number of confirmed COVID-19 cases in Osun is 20 and Oyo 9. Lagos State retained its lead with 109 cases, followed by the Federal Capital Territory, Abuja, which has 41 cases. The NCDC subsequently apologized for the error on its Twitter handle on Saturday. A breakdown as of Saturday evening shows that Lagos has 11 new cases, 3 in the FCT, 3 in Edo, 2 in Osun, and 1 in Ondo states. 2 new deaths have been recorded, 1 in Lagos and 1 in Edo states. Meanwhile, the Chief Medical Director of Lagos University Teaching Hospital, Ndu Araba, Professor Chris Bodi, who confirmed the death of a COVID-19 patient in the hospital, said the patient was brought unconscious to the emergency room late in the evening on April the 2nd by his friend. In Osun, the missing COVID-19 patient from Osun State Isolation Center in Ejigbo has been apprehended and returned to the center. Chief Press Secretary to Osun State Governor Ismail Omikpidon confirmed that the patient, a woman, was apprehended in Ejigbo town and returned to the facility by the police. The Minister of Health, Dr. Osagie Ihanire, has said that Chinese doctors, nurses, and medical experts will arrive in Nigeria soon to assist in the fight against coronavirus. Reacting to the plan for Chinese doctors and nurses to assist Nigeria, the Medical and Dental Consultant Association of Nigeria, University of Ilori Teaching Hospital, has advised the federal government against inviting medical experts from China to help in fighting coronavirus pandemic in the country. Similarly, Nigerian Union of Journalists has condemned the decision of the federal government to bring Chinese medical doctors to Nigeria to help fight COVID-19, despite the fact that Nigerian doctors are doing exceptionally well in treatment of COVID-19 patients. NUJ National President Chris Isigozu advised the federal government to stop the plan to bring Chinese doctors to the country. In a related development, Ondo State Governor Oluwarotimi Akeredolu has ruled out taking COVID-19 patients in the state to Lagos for treatment. Governor Akeredolu, who stated this in Akure at a World Press Conference, said the state has the capacity to treat the patient, who is a military officer that just returned from India, and that contact tracing for the patient has also commenced. Also, Cross River State Government has commenced the mass production and distribution of nose masks free of charge to residents of the states. In Enugu State, health officials have commenced the fumigation of the metropolis and neighboring environments in the state capital.
We mapped out Peaks Park, bearing in mind that a lot of people gather there to enter bus, either they are coming to Nsukka or they are traveling to any other place from there.
In a related development, Imo State Governor Hope Uzodinma has ordered the lockdown of the state as part of measures to prevent the dreaded coronavirus disease from entering the states.
The Imo initiative is therefore intended to spur us as a government and as a people to rise to the occasion and stand up valiantly for our rise to freedom from ravaging diseases and the criminal fraternity among us, whose sole ambition is to deprive other citizens of their lives and property and the rewards of their hard work and success.
Roseline Ebhoramen reporting.